Our patient is, her name is Natalie Tonateo, and she will be answering all the questions that you may have about the plastic surgery journey that she went through. So I hope that you can join, and if not, this will stay in the stories, so you are more than welcome to ask, to see it later or ask her any other questions.
Hi, can you hear me?
Yes, I can hear you.
Sorry, I was having a little technical issues.
Not a problem. Thank you for doing this, taking time of your day to do this for other patients. You're very nice.
You're welcome.
You look beautiful. So for anyone that's just joining us, I'm just going to repeat the title of today's live. So we're doing a live on our patient's experience of plastic surgery with Dr. Salvador Medina, and we do this because we know it's it's a unique journey. It's a surgery, it's plastic surgery, and a lot of you have questions for us, but we answer them as best as we can. But we figure that speaking with someone that has gone through the journey is always more comforting. So we do this for you guys, about once a month. So this is a treat that everyone that's joining gets. And I'm going to introduce you to our patient. Her name is Natalie Tonateo, and I will let her as much as we can. And please do answer if you're watching any questions that you may have. Well, I'll be guiding her through with questions. So, Natalie, the first question I want to ask you is, tell us about your journey. Like, when did you start thinking about plastic surgery? How was that process?
Yeah, so thank you for having me. So I started thinking about plastics actually about 10 years ago. Prior to I had the gastric sleeve surgery with Dr. Ariel Ortiz at OCC. And prior to my sleeve surgery, I had started to interview several plastic surgeons all over the country for tummy tuck. At that point, I didn't know that I could have been a candidate for bariatric surgery, so I just thought I needed a tummy tuck because I had PCOS and thyroid issues. And so I interviewed about 8 to 10 different plastic surgeons in the U.S.
Wow.
So had the sleeve surgery in 2018, dropped about 60 pounds or so, and then started noticing even more loose skin, which I'm very thankful that I waited to have the sleeve surgery and lose the weight, right? Because a lot of people have a misunderstanding that plastic surgery is weight loss surgery, and it's not. So I waited until I was closer to a healthier ideal weight range. My ideal weight, I was within about 10 to 15 pounds of my goal weight when I had plastics. And the thing that stood out about Dr. Medina is that all of the surgeons in the United States that I interviewed told me that I would only need a tummy tuck. Dr. Medina was the only person that told me I should go all the way around and lift everything around all the way 360. And so then I interviewed several of my friends that had a full lower body lift. And then, and nobody had regrets. My biggest fear was having the scar on my back, which that was literally the easiest part of it, because your incisions are numb for a week, so you don't feel it anyway. It healed the fastest. And all of my girlfriends that had had just regular full tummy tucks wished that they would have gone all the way around. So now they were scheduling secondary surgeries for back lifts and Brazilian butt lifts and things like that. So I was very thankful. That instantly gave me credibility with Dr. Medina, that just the fact that he recommended something different. And then I found out that in the United States, most surgeons don't recommend a full lower body lift because they're not comfortable doing the procedure. So okay. Dr. Medina definitely has a vision, and I'm thankful that he had a vision of what needed to happen with my body, and I'm thankful that he told me the truth. So.
And in talking about the surgery, Dr. Medina is in Mexico, and just tell us about
Yes.
how did you hear about him in that process? Because, you know, it is different. And we'll talk about the hospital and so that people understand but what it looks like. But, you know, what do you think about, like, when you realize, you know, I love the doctor, but he's in Mexico. So how did that work for you?
So initially I was very scared, and I had been to Mexico several times prior, but I wasn't familiar with the healthcare system. I talked to my dad about it, and actually my dad was very supportive and very excited. Come to find out, we had many family members have procedures done in Mexico, and they just hadn't talked about it. So I think more people, medical tourism is a really big deal right now, and I just don't think enough people are talking about it. As I researched, I found out that many of the hospitals are owned by Texas Health down there, and I'm in Texas, and so a lot of the hospitals are owned by different U.S. entities. And in addition, the healthcare down there was superior than what I found in the United States. And so, but it did take me a lot of research. I wouldn't just go to anybody in Mexico. I was very particular about who I went to. He came highly recommended by Dr. Ortiz at Obesity Control Center. So Dr. Ortiz recommended Dr. Medina. I didn't find much literature online about Dr. Medina and his work, and so I didn't know too much. So then I joined the groups and started looking at pictures, and then it was really when I had a conversation with Dr. Medina that his bedside manner, he was very educated and eloquent, very well spoken, and he really put me at ease. I didn't have any insecurities or fears in going to him. And so I've been to him twice now for multiple procedures, and his anesthesiologist is also amazing. And so that was also a really big deal to me, to make sure that, you know, because we do hear horror stories, but having a good anesthesiologist and a good medical team was important. So
And for anyone that's just joining us right now, we're talking with a Dr. Salvador Medina's patient, who we're very gracious that she took some time out of her day to answer your questions, or future patients or current patients. For anyone that just joined, can you tell us what you had done? So you had the full procedures that you had done?
yeah. Yes. Okay. So I had a full lower body lift that included a tummy tuck with muscle repair, pubic lift, outer thigh lift. So that's the first thing that I did with him. And then the second time I went back to him, and we broke this up into 2 procedures instead of 1 because my hemoglobin was low the first time. So he was very cautious and very conservative not to put me at risk. I didn't have any complications. I was a little bit negligent after the tummy tuck because I think I sat down too long, and I realize now that I should have been either standing up or laying flat in order for my lower abdomen and my pubic area to heal flat. So the second time I went back to him, he did a small revision of my tummy tuck incision that I caused to come open. And then he did a lipo and a Brazilian butt lift. I literally took in pictures of the Instagram models, and I said, make me look like this. This is what I want to look like. And he did it. And so I had, on the second time around, we did a tummy tuck revision. We did a Brazilian butt lift, breast augmentation, and then I had a small scar revision from a breast reduction that I had back in 2003. So yes, you heard that right. I had a breast reduction, and then I had a breast augmentation with Dr. Medina. And
okay.
A side note to that is that I've heard that breast reductions do lower your risk of breast cancer. So that was a good thing. And then we did the implants when I went back the second time.
Okay. And I want to talk about a lot of the questions we get is about the facility. So, you chose him, right? You interviewed 10 doctors, you chose him, you felt comfortable,
Right.
and you get to Mexico to the hospital. So tell us about the facilities, when you get there, what do they look like, how comfortable you felt, and so on, or didn't feel.
Absolutely. Yeah, no, it was very comfortable both times, and that's why I plan to go back a third time. So when I arrived, we checked in with the registration desk. That time, so I don't speak Spanish, so we did use Google Translate to get checked in. And then they took us upstairs to the room. It was a beautiful room. Everybody did speak English up there. Very comfortable, very almost the same as what you'd see in the United States. Very clean, comfortable, sterile. Um, they did take very extra careful precautions, just keeping everything sanitized and very meticulous. Um, they are very catering. They came in and they give you your IV. The same, nothing is really different as far as the actual process than in the United States. They give you your IV. They bring food. They have great food. They feed you all the time. Um, and then you consult with the cardiologist and Dr. Medina, and then he makes the marks on you, and whether or not you go into surgery that day, or usually he marks on you the same day, right? And then you go into surgery, and then after surgery you come out, and Dr. Medina is definitely hands-on, very involved, very and the whole staff is amazing. They're just very catering to all of their patients. So yeah.
Okay. I'm going to repeat the title. Just we're talking with Dr. Salvador Medina, one of our patients, or his patients, not my patient, and about the process of plastic surgery. And Natalie has volunteered to answer any questions that future current patients may have. And the next question I have for you is just, what about the process post-surgery? So you got the surgery, you chose him, you went to the hospital, you liked the facilities. So what did you had a lot of stuff done, but how was the recuperation process?
Correct. So I stayed at Hotel Lucerne, and I stayed about 5 or 6 days each time. And the recovery for both surgeries so far was not bad. When they say it's discomfort, it literally is more of a muscle discomfort versus you don't feel pain in your incisions because they're numb. It's hard to feel, sometimes you're wrapped up tightly, so you feel a little bit constricted, right? And you want that so that you're not swelling a lot. The drains, we had drains after the lower body lift, and those were important because it got rid of all of the extra fluid. So the recovery for both of them is not bad. It sounds intimidating. The tummy tuck part, the way that I could describe that pain is like you've done 1,000 sit-ups. It's that kind of working out muscle pain. But other than that, neither surgery was very painful. Just more discomfort. So I did stay there for 5 or 6 days after each one. The only thing I would recommend is to ask the hotel for a shower seat if they don't have one, especially after a tummy tuck. But other than that, I did have a companion that helped me shower and change my bandages and things like that. I think it's just important to really take it easy. Once I flew back to the States, I still continued to just relax for probably another 2 to 3 weeks. And so, again, it's important that you lay flat, and you don't overdo it, but that you're active enough as well just to keep circulating, right? So the hardest part, I think, is just to take it easy for a few weeks. And it's hard because we get so busy working and
Yes.
picking kids up from school and stuff like that, you know, but that was probably harder than any kind of pain, or the procedures itself were not super painful.
Okay. Um, I'm just going to answer quickly a question. Is there a waiting list? There is no waiting list. We have a surgical coordinator who I'm going to put the information after in the comments, where you can contact her and she'll give you. He's certainly filled up. There's a couple. There's, I think this month's filled up, but there's no waiting list. You're just putting to the first available that he has, or whatever is convenient to you, Kimberly. Okay, my last question to you is, was it worth it? One of the questions that people are like, you have to, certainly you have to take time off, it costs money and so on, but was everything worth? You got to fly to Mexico. Was it for whomever is watching right now and is interested in this journey, was it worth it? And tell us a little bit about your life post plastic surgery. One second, everyone listening, we're having technical difficulties. I can't hear you. No. Whomever is just joining, we're talking to Dr. Drsalvadormedina's patient, Natalie, who's answering all your questions you may have on plastic surgery, but we just lost her audio, so she's trying to regain it.
Can you hear me?
Yes, we can hear you.
Can you
yes.
guys hear me yet? Okay,
yes.
There you are. Okay, sorry, I don't know what happened.
No worries. So the question was, I know, it was a process. You flew to Mexico, you chose the doctor, you had to take time to recuperate, but tell us about, the question is, was it worth it? And tell us about your life post plastic surgery.
1,000% worth it. Actually, it's improved my health, my attitude, my business, therefore my income. Our health is our wealth, and 1,000% it was worth it, because it has given me more confidence. I kind of spend more money on clothes than I should, but I've never been able to wear a bikini until last year. I've always had a big tummy until I saw Dr. Medina. So it's given me an entire new perspective and a whole new life. And so my advice is, there's no growth in living in fear. Sometimes we just have to walk through the fear in order to grow. And so I wouldn't trust anybody, whether you go to Mexico or whether you stay in the United States or wherever you go. Price was not really an issue for me. I didn't go to Mexico to save money. The reason I went to Dr. Medina is because I wanted to hire the best person to get me the results that I wanted. And so that's what I did. And I would not go anywhere else. So I found that, it's improved my every aspect of my life. So yes, it's 1,000% worth it. I'm going to go back again.
Wonderful. And if for any, I don't know, I know we spoke about the process of getting there, choosing him. Is there anything else you want to share? Perhaps when you were going through this process of being a doctor, you look for patients that are looking into, having surgery with him, or anything you want to say to anyone considering this, plastic surgery?
The only thing I would have done different is just to do it sooner, the whole thing from start to finish, because it's easy to overanalyze and it's easy to make excuses and to question, but just stop questioning, just trust your instinct, just go through with it, you won't regret it. It's 1,000% worth the investment in yourself, your health, your self-esteem. There's no reason to live with a bunch of extra loose skin on your body. That is not attractive. That sounds superficial. But it really does help your spirit, your energy. Yeah, I just wish I would have done it sooner. We're worth it.
Yes, I agree with you. I manage his social media, and it's one of my favorite accounts because I see how much his patients are thankful, how much, the before and afters, how, sometimes you don't recognize, right, the two different persons in the picture.
Right.
So, I agree that, it's always good to be in good hands. On his social media, on his website, which I posted, you can see his credentials, and he's got the top credentials for Mexico. He's one of the top surgeons in Mexico, but not only that, but he's kind. So I want to, I'm doing this once a month so that, it takes out all the fears that may have. And if you don't choose him, that's fine, but it's certainly good to talk about, the process that we've gone through, because he's also been my doctor. So I want to thank you so much.
Nice.
Yes. So I'm a true social media, with a proof. So I want to thank you
absolutely
so much for your time and for doing this for the other women and men who have joined the chat. And as always, I put there his email, which he checks directly. I put the website. And then, Natalie, anything you may have, any questions you may have in the future, you know where to go. But thank you so much.
Yes.
And I don't see any more questions. Let me just check before we check out. So that's it. Thank you.
And you guys can call me or text me or friend me or message me too. If you guys have any questions, I'm happy to talk to anybody or FaceTime you or whatever you guys need. Just let me know.
Thank you. And join our group. We have on Facebook, we have Dr. Salvador Medina Post-Bariatric Surgery Group. And Natalie's there, and it's a very active group, and everyone gives each other support. It's a great way to kind of get warmed up with, all kinds of questions. And then just let us know, anything we can do to help. We're here to help. So thank you. Have a wonderful day. And we'll see you guys hopefully at the office soon. Bye-bye. Thank you.
Thank you. Bye.